Hey guys, this is Dr. Ron Martin from HealthSource of Sicklerville, and today I want to go over our condition of the week. Our condition of the week this week is lower back pain. Now, lower back pain is one of the most common conditions that people are diagnosed with in this country. It's one of the most common things that people are prescribed narcotic medication for, and that is a big problem. So we need to do everything we can to help people get a healthy, alternative, natural type of care that's not addictive and not habit-forming, so that you can actually get well. So let's talk about lower back pain. Now, lower back pain is most commonly caused by problems and irritation in the joints or the muscles of our lower spine. You can irritate the discs, which are on the front, and that can cause more severe symptoms to the nerves, things like sciatica or types of numbness and tingling in parts of the leg or the spine. So we don't want to ever let it get that bad. Now, when we look for lower back pain, we evaluate a few things. We want to evaluate the mobility of your spine. We want to make sure that it moves forwards and backwards, side to side, and rotates. These are important because if your spine doesn't do that, that means you have to adapt to abnormal movement, which creates a stability problem in the long run. And that now incorporates weird muscle movement and weird muscle length. So you end up with a spine, instead of looking nice and level and straight, it gets all crooked and weird. So we don't want to have that because nobody wants to look weird. So when we evaluate the spine, we're looking at the mobility and the alignment. We're also looking at how that affects your inflammatory response. If you have a lot of inflammation, that's going to put irritation and pressure on the nerves, and that's what's going to cause the more common spikes and symptoms. So we don't ever want to have a really inflamed person or chronically inflamed person, because then you're always going to have symptoms. That's not something that you want to deal with. Now, the last thing that we affect and that we try to treat and evaluate for is the stability. So we're always checking to make sure that you have balance in the musculature of your spine. You have a lot of muscles that affect your lower back, whether it be core muscles specifically or the lower back muscles that come from your spine into your hips and pelvis, and even your butt muscles have a big impact on how your spine works. So we're taking a very in-depth evaluation using a physical exam, a neurological exam, range of motion testing, and movement assessment to see what's going on with your spine to evaluate lower back pain. Now, if you or somebody you love has lower back pain now or has suffered with it in the past, then I urge you to come and seek the attention of a chiropractor so that we can evaluate you and determine what's the best course of care to get rid of that pain. Now, if you have any more questions or looking for more information, you can go to our website at HealthSourceofSicklerville.com. You can follow us on Facebook at HealthSource of Sicklerville, or you can also follow us on Instagram at HealthSource Sicklerville. This has been Dr. Ron, keeping an eye on your spine.